Hello and welcome back. I'm so excited you're here today. My name is Leah Vachani, and I am your host for the Over 40 and Fabulous Summit. Today, I have an amazing guest, and I can't wait to introduce her. We are going to be talking about a topic that I'm actually really curious about learning more about, too. So, before we start, let me introduce Dr. Felice Gersh. She is a multi-award winning physician with dual board certifications in OBGYN and integrative medicine. She is the founder and director of the Integrative Medical Group of Irvine, a practice that provides comprehensive healthcare for women by combining the best evidence-based therapies from conventional, naturopathic, and holistic medicine. For 12 years, she taught obstetrics and gynecology at Keck USC School of Medicine as an assistant clinical professor, and she now serves as an affiliate faculty member at the Fellowship in Integrative Medicine through the University of Arizona, School of Medicine. Felice is a prolific writer and lecturer who speaks globally on women's health and regularly publishes in peer-reviewed medical journals. In fact, she just told me about a new article that came out. She's always writing. She is the best-selling author of the PCOS SOS series and her latest book, Menopause, 50 Things You Need to Know. Wow. Dr. Gersh, welcome so much. We're excited to have you and to really just kind of pick into your brain and for you to pour out all of that amazing knowledge you have for all of us women over 40. So thank you for being here.
Oh, it's my pleasure. And I'm so excited to talk about women and heart health because it's a topic that really is underappreciated in terms of its importance. In fact, I just saw an article that women and even, the doctors don't typically acknowledge and understand that cardiovascular events remain the number one cause of female death. So it's not a small issue.
Yeah, I think it's really important that we're talking about this because, you know, many women, as you said, we focus on other areas of health, breast health, breast cancer, other areas of health, and those are forefront in our minds, but we don't often think about our cardiovascular health. And so today, I really want to talk about heart healthy and menopause, like why diet and exercise often aren't enough. And I'd like to start with how is the cardiovascular system affected by menopause as we go through these changes over 40 and beyond?
Well, the first thing to recognize, and this is really foundational for all aspects of women's health, is that the fundamental development and evolution of the female body is designed for the prime directive, which is procreation, reproduction. Now, fortunately, we humans do have some options, whether we do or don't, and when we want to and don't want to have babies, which is great. But understanding that the female body is really designed for fertility, pregnancy, and so on is really essential to understanding estrogen and also progesterone, its sidekick, and the impact that menopause has on all the organ systems and enormously on the cardiovascular system. So because women go through pregnancies, assuming they do, but their bodies are certainly equipped for that purpose, they need to have a very incredible dynamic cardiovascular system, because pregnancy is now recognized as the ultimate stress test of a woman's body. It really is a challenge. That's why being optimally healthy before pregnancy is really important, and women who aren't will often suffer the consequences with pregnancy-related complications. During pregnancy, the volume of blood dramatically rises, at least 50%. So you need to have a heart that is really pumping really robustly to get all that extra volume around the body. And there's so many changes in the vascular system during pregnancy. And all of this requires hormones. And that is like essential. And estrogen, I call it the hormonal glue that actually links every organ system in the body together and manages to keep everything optimally functioning for the purpose of successful pregnancies and fertility. So understanding that the heart, for example, in a woman has this more dynamic, robust capability of pumping means it needs more energy. And in fact, it's like really fascinating. Mitochondria are the little organelles, the little structures in cells that create energy. And they're just more functional in women in their hearts. And it's not even widely recognized that mitochondria cannot do their jobs properly if they don't have enough estrogen. And the estrogen in the form of estradiol, the kind that's made by the ovaries. And in pregnancy, estradiol is not the dominant estrogen, but there's plenty of it. And it turns out that not only is estradiol critical for heart health, but also certain metabolites like that are made through the detoxification or the transformation of estrogen in the liver. Some of those metabolic byproducts actually have receptors on the heart and actually help to create more energy. And there are other products that act to bind to receptors, but estrogen is essential for their function. So that's called estrogen-related receptor. The receptor is bound by something else, we don't even know what, but it won't work if you don't have enough estrogen in the immediate vicinity. So to have a really healthy female heart, you absolutely have to have estrogen. Now, fast forward to menopause, what happens? Well, the ovaries become aged and the eggs are diminished and then ultimately gone, and estrogen production drops. It becomes erratic and then drops and then is ultimately zero. And there's nothing that picks up the slack. It's not like there's like a spare of tire, and then you could pull it out. And there's no spare estrogen producer. And there is some estrogen that is made through conversion of androgens in fat, but often that's the wrong kind of estrogen. It doesn't work in the same way. So you can't really count that as like the right thing. So the bottom line is that there is no truly wonderful compensatory mechanism for loss of ovarian function and this vital life hormone. So I have ceased to call estrogen a sex hormone. Of course, it's involved in all reproductive functions, but in order to be successful, you need a healthy body to support a pregnancy, and therefore I call it a life hormone. And once reproduction is no longer in the picture, it means that all these organ systems are going to have serious challenges, and the heart is one. And this is like a really big deal because most cardiologists don't even recognize it. If you get an echocardiogram on a woman who is into menopause, you will often find a sort of a display of energy deficiency state in the heart that's visualized as mild diastolic dysfunction. And the heart has two basic functions. It contracts and it relaxes. When it contracts, out goes the blood. When it relaxes, in comes the blood and it refills. And the refilling phase or the relaxation phase is called diastolic. And people know this in their blood pressure. They have two numbers, like 120/80. The top number is the systolic, or that's the blood pressure that occurs in the blood vessels when the heart is pumping out. So there's more blood coming out, so the pressure goes up. And then the diastolic, like the 120/80, it would be the 80, is the diastolic. That's the pressure when the heart isn't pumping. And so the amount of blood volume drops and the pressure drops. In the heart, the diastolic is the filling phase. And that is ignored in most cases because it's in men, heart failure is always almost virtually always the contracting part. So it's not contracting hard enough. In women, it often starts with the relaxation part, that it's like a stiffer heart. It's a low energy heart. So you can actually see it on an ultrasound. This is, of course, not exactly real, but if you say this is how the heart is pumping, and this is when you have energy deficiency, diastolic dysfunction, it's like stiffer, and you can actually see it. That's like a giant red flag that there's an estrogen deficiency state involving the heart and its ability to create energy. And this can lead down a path to a type of heart failure that's called heart failure with preserved ejection fraction. That means it can still pump, but it doesn't relax, and it creates a scenario that is potentially really life-threatening. It's really a big deal, and it's just now kind of getting a little bit more attention. But this is like a really big deal. That's why I feel every woman, as she is going through into menopause should have a baseline echocardiogram to evaluate the strength of her heart, how the muscle is working in terms of both directions, the contraction and the relaxation. And so that's like one huge fundamental thing that happens when women are transitioning and then thereafter into menopause concerning the heart muscle itself. And, we'll go through that. There's so many other effects on the blood vessels themselves. There's big changes, and involving the neurological system that is what triggers, if it's the contractions themselves, like the rate, like the because there are problems that can occur in terms of palpitation. So it's, not, there's so many aspects of heart health and vascular health, and how the heart is pumping in terms of the rate that can change after menopause. And for example, palpitations, like very fast heartbeats, are very, very common. And it's often, put aside, oh, you're just having an anxiety problem. Well, that can create anxiety because your heart is going like this. And atrial fibrillation is also a more common problem in women after menopause. So we're just getting started. So I want to make sure that we cover everything.
Well, I mean, that was my mind is now opened up to a lot of questions for you, Dr. Gersh. One of the things that you were talking about that I kind of wanted to just pause for a second, because I know a lot of women watching right now are similar age. I'm approaching my mid 40s. Haven't entered menopause yet, but it's getting there. And my doctor has never offered an echocardiogram or ECG, correct? That's not even been mentioned. So are you suggesting that many women perhaps advocate and ask, for a baseline ECG? Did I hear that correct?
Well, just so I make sure there's a distinguish. So ECG would be an electrocardiogram.
Okay.
So that can be important as a baseline. And certainly if someone is having irregular heartbeats and palpitations, so that's where they put those like sticky things on, and then you get the readout. And an echocardiogram is with a transducer. That's an ultrasound, where you would have an ultrasound. So I would recommend getting a baseline EKG and a baseline echocardiogram, typically by age 50, but earlier if a menopause is happening or symptoms are happening earlier. So there's a huge range of a decade that is considered the official normal age for menopause. So menopause is an arbitrary definition of 12 consecutive months without any vaginal bleeding. And the reality is, if a woman went 9 months, 10 months, had no bleeding, and then suddenly had bleeding, that would be a red flag. Like, what's going on here? It's like, am I supposed to assume that she suddenly started ovulating after 9, 10 months of no bleeding? Of course not. So it's really an arbitrary definition. And we don't even know what that bleeding means. If someone just randomly has some bleeding many months after they haven't had any, please don't assume anything from that bleeding. But so it's arbitrary. You could say 6 months, you could say 18 months, but so, and that's a hindsight, because, and why would I even wait for that? I would never let women just go and not have any bleeding and have hormonal deficiency state and ignore it. But assuming that happened, because back in the day, many years ago, there were no options anyway. That's what happened. There was no option. So what happens if we look back is that that can happen over any type of time frame. So if there's huge variation among women. So officially, the normal definition of menopause is it happens between 45 and 55. That's a decade right there. So a woman who actually would be officially in menopause at age, say, 46, things were happening in the previous decade. From her late 30s, things are already changing. But if a woman goes through menopause at 55, then we have to think about a little different timeline. And then there's some women that have what is called late menopause, that would be over 55, and between 40 up to 45 would be early, and before 40 is premature. So we really have to have a very open, flexible mind about when to do the timing on everything. So this is really very individualized, personalized type medicine, because you've got to look at every single woman and look at the global picture of her health to decide when to get these baseline tests.
Okay, thank you so much for clarifying that. I really appreciate that. I would like to dive more into, since we're on the topic of kind of lowering our risk of developing heart disease, can we expand a little bit more on that and give us some more information on how we can be proactive about our health?
Absolutely. So once it's widely, and at least among all of you out there, and I'm so excited you're watching, recognize that cardiovascular changes are going to occur with the onset of ovarian aging or senescence. Because I'm on a mini campaign, it's not going to change, but to get the name changed and stop calling it menopause, because menopause gives everyone the wrong idea. It's really not about periods, it's about ovaries. And the loss of the period is one symptom of loss of ovarian hormones. You could have called it something else, because what if a woman had a hysterectomy or an endometrial ablation, her uterine lining was burnt out, then there is no period to even look at, right? So we just need to really rethink it. And once we understand that it is about the ovaries, and the period is just a manifestation of what happens when you do or don't have when you do or don't have hormones produced. So the number one thing is we want to try to preserve ovarian function as long as possible. There's data showing that women who go through menopause at an earlier age, because I showed you this big range, right? So women who go through an early menopause, so that would be prior to the age of 45 and between 40 up to 45, and premature is even so much worse. But if you have, say, an early menopause, your risk of an earlier death is higher. Your risk of developing all the so-called diseases of aging, and we can run through them all. In addition to cardiovascular, you have osteoporosis, osteoarthritis, dementia, prolapse of the bladder, and incontinence. There's so many things that can go wrong with what's called aging. But really, aging is about deficiency states and about the accumulation of free radicals and oxidative stress and inflammation. And all of that is related to estrogen. And of course, there are many other factors. That's the things that we can control. And it turns out that having a longer lifespan of your ovaries is really healthy and really important. There's a limit to what we can do, but we do what we can. Even if we can prolong ovarian function for 6 months, like in someone like you who hasn't even reached really menopause yet, or even you're in perimenopause sort of by definition, but you may have no symptoms, no obvious findings, but things can be happening that you don't even know about. That's the thing. You can't feel your arteries changing, you can't feel neurons changing. It's years and years and years, sometimes decades, before the sequela of these early changes really manifests clinically. So we want to get on it to try to keep the ovaries working as long as possible. A plant-based diet filled with antioxidants, fiber, polyphenols, all of the magical things that go into being a healthy individual really can make every organ system healthy, including your reproductive organs, which involve your ovaries. So don't underestimate lifestyle for helping to keep ovaries going longer. If you don't get adequate sleep, your ovaries may poop out sooner. So, like circadian rhythm issues, so if you travel across time zones, if you are unfortunate enough to be in the 25% of women who are working night shifts, working at night, this is what I'm not telling you have to quit your jobs, but I just at least recognize you may have to work harder to be healthy, because this is not an insignificant health problem to not sleep at the right time and be consistent with it. So exercise, fitness can help to keep ovaries healthy. We now know that you can actually pull follicular fluid from around the eggs in people who are metabolically unhealthy, like people who have irregular cycles, diabetes, obesity, that type of thing, hypertension. And you'll actually find the fluid that is surrounding the egg to be full of inflammatory cells. The egg itself is being damaged by surrounding inflammation, which creates ovarian shorter lifespan. Eggs become malfunctional. They have what they call poor quality. Okay, and that of course would affect fertility as well for women who are getting into their early 40s and they still want to have kids. So these are things that can help to get your ovaries to be healthier. And also there are certain supplements that some may help. The one is DHEA, that's an androgen that's anabolic. It builds things up, builds bone and muscle, but seems to also help the ovaries. Melatonin, which is a very potent antioxidant. And of course, people know melatonin is about sleep, but melatonin, like everything, is a multitasker and it does many things in the body. There are ovarian receptors for melatonin, which is one reason why if you don't get adequate sleep or you have a sleep disordered breathing problem or sleep apnea, you will be more prone to having irregular cycles, infertility, and potentially an earlier onset of menopause. So do what you can to get adequate sleep every night. You can also take a small supplement of melatonin. So this is not a mega dose, but maybe one half or 1 milligram every night. And that can be sometimes potential for welcoming sleep, but it's acting as an antioxidant. In fact, melatonin can be given in very high doses, like 10 milligrams, and it can be beneficial, like for breast cancer. So melatonin has tremendous antioxidant potential to reduce oxidative stress and inflammation, including in the ovaries. And then work on your weight to get a healthy body composition by time restricted eating. Try not to eat snacks all day long. Try not to eat late at night, and try to put more of your food into the first half of the day when your insulin works better. So everything in the body is on a timer, including the pancreas, and insulin just works better when you eat food in the morning compared to eating food at night.
I
So
mean,
all
something I
these
can
things are
totally
helpful.
get behind. As a nutritionist, I completely agree with everything you're just saying. And I'm so happy you mentioned the basics, right? Eating healthy, taking care of your sleep, taking care of your exercise. Those are basics, but we can use that as a foundation. And as a nutritionist, that's basically what I do with women. So I'm so happy you said that.
Well, it's foundational. So we
Foundational.
want to do everything we can to keep our ovaries happy and working as long as possible. So, and of course, everything that we were just talking about would be applicable for the rest of your life, right? So first I'm talking about maintaining ovarian function, and next it's about keeping things, just generally healthy in the body. And then there are these amazing foods. They're all plant-based foods, which I call nature's gift to women. And they are all the foods, and there's so many that have the polyphenols called phytoestrogens. So it's like a miracle. There are plant-based molecules that are not estrogen, but they have a little similarity in the structure, and they actually combine to estrogen receptors and function as a mini version of estrogen in a very safe and wonderful way. And that we have now data showing that you can actually even extinguish, and that's a powerful word, night sweats and hot flashes, which are really harmful in a whole myriad of ways, and including to your cardiovascular system. So hot flashes aren't just unpleasant and interfere with your quality of life, but it actually is associated with higher chances of getting heart attacks and strokes. So it's very bad on so many levels, and you can actually eat phytoestrogens and dramatically reduce the incidence of night sweats and hot flashes. Now, so I think of them as a critical adjunct to every woman who is transitioning into menopause and the years thereafter, because no matter how I give hormones, and I prescribe hormones prolifically, I love hormones because I just treat it like estrogen, progesterone, and testosterone, which is a little different category because it does not change around menopause. It has its own issues. But I treat it, all these hormones, like every other hormone. Like if thyroid, I wouldn't say, oh, you have low thyroid, but who cares? Maybe we treat it. I wouldn't say you have, poor production of the ovarian hormones, and who cares? Of course I care. That's what, I mean, endocrinologists would never say that about any other hormone except ovarian hormones. It's like nonsense. It's a hormone, and we need these hormones. And these are like, if you create a pyramid, these are, depending on how you think of a pyramid, these are like the pinnacle, or they're the foundation, because you need them. You can't have normal cellular function without them. That's why they're there. And we cannot replace them, but we can augment them, and we can do amazing things with the plant-based phytoestrogens. And in fact, and you are probably even more knowledgeable in this is your total specialty, but I call them, the superfoods that have been labeled as superfoods. When you look at what's in them, the ingredients in terms of the polyphenols, they all have phytoestrogens, like pomegranates, which are wonderful, and they have the ellagic acid, which converts into the urolithins, like urolithin A, which a lot of these now are marketed, the phytoestrogens, as concentrates, and they're given as supplements. And I'm totally for that. But you can end up having like 25 supplements, each one with a separate phytoestrogen, and that gets to be a little overwhelming. So you could concentrate on taking some, but a lot of it you should just eat and hopefully nurture your gut microbiome, which is another huge thing that transitions in a negative way when women go through the menopausal transition, which has a huge effect on the cardiovascular system. So in terms of like some of the phytoestrogen foods, which are so critical for cardiovascular health and brain health and feeling good, is the beans and the lentils, the legumes. So the one that gets the most press is soy, but soy is a bean, and there are all these other beans also have the isoflavones, but soy has a high concentration of them. And poor soy has been so maligned, but when you eat whole organic soy, it really is a superfood. And there is actually published data that it can improve fertility. That means it's helping your ovaries and your eggs. So 2 thumbs up for organic whole soy, like soybeans, the edamame, the miso, the tempeh, and the tofu, but not soy pretending to be ice cream, burgers, cheese, and whatnot, out there. So the real honest to goodness, healthy organic soy, not the one that's covered in herbicides and pesticides and God knows what else. So we want that. And then the nuts and seeds, they have lignans, like the one that's most famous is flax seeds. And lignans are phytoestrogens. And then we have like fruits like red grapes, and they have the resveratrol, and we have apples, onions, garlic, and they have quercetin. So it's just like amazing, and the pomegranates I mentioned. So foods are like magical estrogen mimics in a very healthy way. So we incorporate all of them. And how much data do you need? There's thousands of articles showing that your nutritional status and eating these foods are hugely beneficial for cardiovascular health. And I mentioned the gut microbiome, the collective of trillions of microbial life forms in the gut. And when you lose your estrogen production from your ovaries, the transformation of the gut microbiome composition is dramatic and negative. And then you end up getting what's called impaired gut barrier or leaky gut, because the good microbes, we call them the commensals, the ones that are really working to help keep everything working perfectly. And there's so much complexity in this, but when you don't have the right composition and you have what's called dysbiosis, the wrong gut microbial population, you get a loss of the protective mucus barrier that protects the lining cells of the gut. So without that, all the toxins, they call them endotoxins and lipopolysaccharides in the gut, they get right up to the lining and create a lot of inflammation and damage. And the cells, the single lining cells of the intestine, they're like really close together. So they call them tight junctions, but the little fibers that hold them together start to degrade and the cells start to drift apart. And then all these toxins from in the gut leak into the body proper. And the immune system, which lines the gut, so much of it, 70% lines the gut, all those immune cells, like, zoop, they light up. It's like, what's happening? Invasion. They start putting out inflammatory products called cytokines. And these cytokines travel throughout the body, creating inflammation, inflammation in the arteries. And this is horrific because then you have injury to the artery lining, and then you get like leaky arteries, which you can actually measure with microalbumin testing, and you end up having damaged arteries. And damaged arteries are a prerequisite to developing plaque, and then more inflammation creates more instability of plaque, and ruptured plaque is what ultimately can lead to heart attacks and strokes. And it can be triggered by the gut inflammation and the leaky gut. And then you have magnifying that problem is when you don't have enough estrogen, you don't have the activity of a special enzyme that is in artery walls called endothelial nitric oxide synthase. And estrogen triggers this enzyme to produce a gas called nitric oxide. And this gas keeps arteries really healthy. It also helps to prevent platelets in the blood from aggregating or collecting together, creating, inappropriate blood clotting. So you keep the blood from having that clotting effect, and you also keep the artery walls really healthy and dilated properly so you don't get hypertension, which is another horrible precursor to heart attacks and strokes, and also vascular dementia, which is not a rarity. So all of this is really critical to having healthy vascular system. But we also have a backdoor way for getting nitric oxide, because no matter how I give hormones, once again, it's not the same as having a 21-year-old pair of ovaries. We're not capable of replacing hormones to be exactly like a healthy 20-something-year-old. We do the best we can. It's not the same. It's better, but it's not the same. Better than not having it. So by eating a lot of nitrate vegetables, my personal favorites are kale and bok choy, and of course the famous beets. I love beets. I eat beets almost every single day. They have a lot of nitrates, and then the nitrates, through enzymes that are in the bacteria of the saliva, these enzymes called reductases can convert in the salivary glands the nitrates in the vegetables into nitrites, and then it goes down into the GI tract. And there, if you have all the right minerals and vitamins, you can convert the nitrites into nitric oxide, which is a gas, once again, and it diffuses out and it can go into the arteries to help them to be optimally healthy. So we have to pull every trick out of our hat as women who are aging to have this healthy cardiovascular system, because once again, it's about having the hopefully reduced incidence of heart attacks and strokes, but also vascular dementia, and also kidney problems, leg problems. I mean, the vascular system is what provides oxygen and nutrients to every single organ in the body. So it's like your highway delivery system of all the nutrients. It also takes away all the toxicants. And not having a healthy vascular system can also create a problem with what's called the blood-brain barrier. And when that barrier, which is supposed to protect the brain from getting toxins and viruses and poisons in our blood that are made both from our own cells and also from outside intake, unfortunately, because we live in a pretty toxic world, from getting into our brain. But that, without adequate nitric oxide and healthy arteries, you can have this like leaky barrier, and then you get all this bad stuff into your brain, which can increase neuroinflammation, which can be the precursor to mood disorders, which are highly prevalent in women, and much more so, at least double to 4 times the incidence in men, and also cognitive problems, dementia, and women suffer from Alzheimer's at a rate of at least 2.5 times the incidence of men when you age match them, like 70 to 70, 75, 75. Women will make up 2/3 of the people with Alzheimer's disease. So the vascular system is not optional to any organ working properly, including, of course, the heart itself.
That was amazing that you linked all of that together. So just I know many of us are sitting there like, whoa, I need to go back and listen to that one 3 more times. But if we could just summarize it really quick and correct me if I'm wrong, basically what you're saying is women need to eat for optimal health. We need to eat a rainbow of vegetables every single day, multiple times a day. The more the better, and that will help our microbiome, which will help our gut health, which will help prevent leaky gut, which I didn't know was associated with leaky arteries, something I've never heard of, and can also be affecting leaky brain barrier. Did I kind of summarize that?
Absolutely, absolutely. That's why we can't just do one thing. So the analogy I use is when you go through into menopause, it's like trying to keep a 1,000-piece jigsaw puzzle together so you can see the picture. Now, the hormones, that makes up the 400 center pieces of this 1,000-piece jigsaw puzzle. But lifestyle, all the things we touched on with nutrition and stress and sleep and fitness, everything, lower exposure as much as possible to environmental toxicants, pollution, and so on, and also in your home, what you use for personal care products and cleaning solutions and storage of food and what you cook in and everything. All of those lifestyle functions and attributes make up the 600 surrounding pieces of this 1,000-piece puzzle. We have to try to do it all, not one, not just this one or this one or this one. We can do that and we'll have part of our puzzle together, but to have it all together, to optimize everything, we need to do it all. And I don't know about you, but I always, every time I take out a box with puzzle pieces, there's always another piece missing. It's like, where did it go? How did I lose that? It's like the missing sock. It's like, how did this happen? But as we age, we kind of lose our puzzle pieces. We have to do everything we can. And it's not just one thing. That's why I really, really dislike clinics that just hand out hormones. And that's all they do, because it's necessary, but it's not sufficient. And people don't know that. It's like everyone should have a team that puts together a plan for them, like an anti-aging or successful aging plan, because we don't really have anti-aging, it's really healthy longevity. That's what it's all about. Women statistically live several years longer than men. I think it's predominantly because we have that magical extra X chromosome. It's a whole amazing thing that women are born with 2 large X chromosomes. And what happens is in the early embryological stage of life, both of those X chromosomes are functioning fully. And they change how the genes of cells function. They actually increase the way the immune system of a female functions, so that women, for example, have a much more robust, not just heart, but their immune system. They have more immune cells. They make more antibodies. They make more inflammatory cytokines. We're better as premenopausal women and even as postmenopausal women at dealing with infections, because we have a more competent, very wildly functional immune system, although it becomes less so with aging. And when you have a lot of problems like with leaky gut, then you have more potential to get autoimmune diseases, because women make more antibodies, which can cross-react with our own tissue, because we have this amazing immune system, which is adapted to allow pregnancies. That's why we have this amazing immune system. And so, but the bottom line is that all of these come together to affect our aging process. And we need to look at every single angle and realize that every organ system is involved, and take every tool out of the toolbox to try to stay healthy and keep every organ system right. And that extra X chromosome is our secret weapon in our pocket that gives us extra years of life, because even after a few weeks of embryologic life, one of them turns off. But after already reprogramming a lot of genes to work in a different way, so it's epigenetic modification, they call it, but about 15% of the genes on the so-called turned off X chromosome in each cell actually keep functioning. And most of those are immune related. So we tend to live longer because we get that extra X chromosome. Poor men, they only get that little Y, it doesn't have.
Are you saying my husband has an excuse?
We have the big X.
So is that his excuse for being sick on the couch more frequently than me, is that he only has one?
Yeah, you got the extra
Oh,
X, I
man, he
know.
has an
It's
excuse.
our secret weapon. We live longer, but the problem is that we have more chronic disease. Women make up 80% of osteoporotic fracture patients. We have more joint replacements from osteoarthritis, way more autoimmune. We make up 80% of autoimmune diseases. We, by the time a woman reaches 65, women suffer from ruptured aneurysms and strokes more than men. We start outdoing them in high blood pressure, and we die more frequently from our first heart attack. And women have different presentation of a heart attack, and it's a little different in women. Men typically will have like the widowmaker. They'll have a blood clot that breaks off of a ruptured plaque in their big main coronary arteries, like the anterior descending, the circumflex, the big coronary arteries, and that's what can kill them. But women have what's called microvascular disease, and that's what can kill them from a heart attack. It's the tiny vessels. Every vessel gets smaller and smaller and smaller. Think of like a highway, or like a freeway, and then it goes into the next type of road. And then that has, like, say, instead of 4 lanes, it has 2 lanes, and then it goes down to the 1 lane. It's like, so eventually you get to the single lane, and then you end up at your house, and that's where the mail ends up, So the bottom line is that all the arteries they form little branches and so on. And it's those smaller branches that we call the microvascular system of the heart. That's usually where women have their problems. They have vascular disease in those small vessels, and that leads to a fatal arrhythmia when you have spasm or blood clotting that blocks off those little tiny vessels, but it triggers a fatal arrhythmia, and that will kill women instantly. And so women don't recognize the symptoms, and the doctors often don't recognize the symptoms of heart attack, because it is less likely in a woman to have that crushing pain with the left arm and the chin and the neck. That's less common in women. Women will often have a sense of foreboding, like anxiety and nausea, just fatigue. I mean, they go into the ER and I just feel like anxious. I don't feel right in my body. Something feels wrong, and I'm tired, and I just don't feel right. I have a little nausea, and they say, another anxious woman, here's your tranquilizer and your Prozac, get out of here. You don't, just, go to a psychologist or a psychiatrist. And then they go home and they die. I mean, this is not unfortunately rare, because nobody is recognizing that this is actually a heart attack in a woman. So we are different than men in so many ways. We have our X chromosome, we have our estrogen at way higher amounts than men. And we're just so different because our ovaries will 100% fail somewhere, typically in the majority of cases between 45 and 55. And men will have, they call it andropause, where their testosterone level often will decrease, but it's not the same. And men can often maintain their testosterone longer at much better rates, but not, men are having plenty of health problems these days, because when they're all inflamed and they get the big belly and they're eating the wrong foods and they're sitting on the couch and all that, they will have a lot of inflammation. Inflammation will affect the production of testosterone, and it will lower it, as does environmental chemicals. So men have their own set of issues for sure, but women really kind of go off the cliff with menopause, and men kind of like roll down the hill, But so the bottom line is, you can't, no matter what a woman does, we can help to prolong our ovarian health and lifespan, maybe, by a few months, a year or two. That's probably as good as it gets, but and every little bit matters. Every little bit is beneficial, but you can't like exercise or meditate or do anything and ultimately prevent menopause. It is universal for women, and it is almost universally under recognized for what it means to a woman that goes so far beyond no periods and fertility loss. It's really such a huge disservice to women to have created fear of hormones, and just hating the idea and fearing the idea of going on hormones and resurrecting so-called periods, bleeding again, because they just brainwashed. We have to unbrainwash all women and get them to love their hormones and to be sad when they go away, to get supplemental hormones and not be afraid of it, and then pull every trick out of the book to optimize every organ's function, especially the cardiovascular system.
Well, I've heard a lot of women say, as you said, like, I'm scared to take hormones. I don't really know. I'm like, well, did you take the birth control pill? Oh, yeah. Well, that was hormones. So it's, different, but it's still taking a hormone into your body. But I wanted to circle back because Dr. Gersh, what you said about the woman going into the ER and, having these signs that are not screaming, I'm having a heart attack or heart disease. I want to go back to that because I think a lot of women listening right now are curious, like, what are the early signs or tests that can let us know that we are developing heart disease? And then also, if we are, is it too late to reverse heart disease?
Early stage disease is reversible, late stage is not. And that's really an important distinction because there is sort of a window of opportunity in terms of reversal. That doesn't mean that you can't help at every stage. So you can do good at every stage, but in terms of really doing any kind of reversal, that's early stage. But my expertise and what I try to promote is prevention in the first place. Okay. So now we cannot stop aging. So to understand what aging is, it's really when you have this accumulation of inflammation due to oxidative stress, these free radicals, that it means that our body is not able to like neutralize with our own antioxidants this these toxic products that are produced both by our own bodies and as a consequence of nutritional deficiencies, hormonal imbalances, um, outside toxicants and poisons and pathogens like viruses. So we have a whole host of things that come into our bodies, both from the outside and from within, that create this state of oxidation. And then when you can't neutralize it, you get oxidative stress. And that really is underlying the whole aging process. So everything that we can do, starting really, well, if we could start, in utero, but as soon as possible, to try to keep oxidative stress and its resultant inflammation at a lower level. That will help to like forestall all of these processes that are related to what is called aging. So we really need to get on board as early as possible. And then we can really slow the aging process. We can't stop it. We don't have that capability. Like I can't give someone a new pair of ovaries when they go through menopause, but we can ameliorate a lot of the problems. But I always say, just like what you were introducing, like testing, you cannot monitor what you never measure. So the things that every woman should have, and these all should be done, I think, starting by the, if they're unhealthy or have infertility problems, there's no early to age that's too early. But for sure, by the mid-30s, you want to start measuring all the different like advanced thyroid hormones, because thyroid is very interconnected with metabolic health, gut health, nutrient status, and hormone of the other types like cortisol, estrogen. So you want to know the thyroid status. So you want to get a really comprehensive thyroid panel that would include your TSH, thyroid stimulating hormone, free T3, free T4, the thyroid antibodies as well. And then you want to get a slew of inflammation markers. The basic one, if you only get one, get the old standard high sensitivity C-reactive protein, HSCRP. And there are others. You can get enzymes measured, LPPLA2, myeloperoxidase. These are enzymes that are made by white blood cells. And if the levels of these enzymes are really high on a blood test, it means that you have a lot of inflammatory plaque. That's bad. That means you're at risk for ruptured plaque and a heart attack or a stroke. So these are things that you would want to get, especially as you got older, and certainly if you had other metabolic issues. And then you can get homocysteine, which is an independent risk marker, which is an amino acid, but when it's high, it's a sign that you may have higher risk for heart attacks and strokes, and that you may have a deficiency of folate or B12. And you got to look at, I like to look at methylation capabilities. That's an enzyme, MTHFR, to see if you're good or you have some sort of genetic reduction in your optimization of this process called methylation. So that is another test. You only have to do that once. And it's good to get an ApoE. Now, that is also known as the Alzheimer's gene, but it's not just involved in increased risk, not destiny, just increased risk for Alzheimer's, but also for cardiovascular disease. No surprise, everything's interconnected. And then you would want to get a high complexity lipid panel. So this wouldn't be the old-fashioned 70-year-old thing, which is really archaic, because we now know, for example, people say HDL is good cholesterol, LDL is bad cholesterol. That's wrong. Okay, first of all, cholesterol cannot travel around the body by itself, and cholesterol is inherently good. That's why the liver makes it, because we need it. It makes up all the steroid hormones, cell membranes, the brain. 90% of all the cholesterol in the body is manufactured in the liver. Now, cholesterol is essential, but what we don't want is rancid cholesterol, like oxidized cholesterol. So that happens when you have oxidative stress and inflammation, and also estrogen deficiency. Estrogen helps to keep cholesterol being produced properly, being picked up by the liver for disposal through LDL receptors, and helps to prevent oxidation or rancid cholesterol by optimizing an enzyme called peroxidase 1 that helps prevent oxidation of cholesterol. Estradiol actually regulates the same enzyme that statins help to block to make cholesterol. So estrogen modulates the production of cholesterol in the liver, and without enough estrogen coming from the ovaries, virtually every woman's liver will start producing too much cholesterol. That's why elevated cholesterol is like just standard in women after menopause. So estrogen helps with that, but so can diet and exercise also. So we don't want to just, it's like, that's why it's a team effort. So we definitely want to get high complexity lipid panel, because just touching on what HDL and LDL even are. So cholesterol can't travel around the blood by itself. It needs like an envelope. Just like if you wrote a check, you can't just drop it in a mailbox. You got to put it in an envelope. The envelopes that carry cholesterol are called apolipoproteins, and we can measure them. They are much more valuable as far as the information they deliver than HDL and LDL. And we now know that HDL, if it's very high, it can actually be a high risk for heart attacks and strokes, because it has no functionality. So, and functionality comes from estrogen. Estrogen helps to increase the production and the function of what's called reverse cholesterol, apolipoprotein A1. So you don't need a whole course in lipids, but it's important to know that your doctor better know this. Somebody better know this if they're taking care of you, and that getting just the old standby lipid profile is completely archaic and inadequate to the task of understanding what's going on. So you want to get an LP little a. That's another marker that's also regulated both by your genetics, which we cannot change, but also by estrogen. And it's good to get levels of small dense LDL. Small dense, that would be the one particle that would be good to get to see, and that's also associated with increased cardiovascular risk. So you want to get a really high level lipid profile and have someone who knows how to actually interpret it. And then I like to get nutrients, because nutrients are essential to cellular function, and often people are deficient in nutrients for a variety of reasons. Their diet is crappy or they don't absorb them. So we want to check at least foundationally vitamin D. We want to check B12. I like to check omega-3 levels and ferritin. That's the iron storage protein. And then also you can also measure CoQ10 now. You can get entire micronutrient panels, which is fantastic. Then you can actually see what nutrients you're deficient in or insufficient in. So to me, that's really important. And I like to get heavy metals, because lead and mercury are really high in prevalence in people's bodies, and we need to know that and get them out. And then also autoimmune. So I like to get an ANA. And depending on the gut situation, maybe celiac markers, so everything has to be somewhat individualized. So that's why you need somebody to get to know you, right? Because you need to have everything individualized. But even just foundationally, you want to get inflammation markers, you want to get high complexity lipids, thyroid, and nutrients. Those would be like foundational. And then in terms of imaging, I like to get ultrasounds of the heart, as I mentioned, the echocardiogram, of the carotid artery ultrasound, of the lower extremities, which actually mirrors the heart, the coronary arteries. It's like fascinating. So what goes on in the legs seems to mirror what goes on in the coronary arteries of the heart, and the aorta, the big one, okay, to look for things like aneurysms, because that's horrible. People can die from ruptured aneurysms. So those would be like the imaging. And then what I'm ordering now much more is a coronary artery calcium score, because now finally they have some data on women, which was sorely lacking. And so you want to see, this is looking at sort of a later stage kind of thing, how much calcium is accumulated in plaque that's in your heart arteries, your coronary arteries. So those would be like the basic sort of testing that I would like to do. And then lastly, a body composition. So this is like really important. Just knowing somebody's weight is not enough. BMI is now archaic too. We want to know how much muscle you have, lean body mass, how much fat you have, and where it is. Do you have a lot of visceral fat? Do you have fat around your liver? If there's even a question, I will get an ultrasound of the liver, because I want to look for non-alcoholic fatty liver disease, which is highly prevalent in women as they transition and are in menopausal years. So it's a lot. I know this is like overwhelming, but when you just do it in a sequential manner, you just get it all done. And then you have your foundational tests, and then you can then tailor it afterwards based on what you as an individual need.
Yeah, I'm glad that you actually went into detail because, everyone watching here can go back and replay this too if they really want to know and they want to have a conversation with their doctor and start that conversation where the doctor, if I'm going to a doctor and they're not doing these tests, it's time to find a new doctor if they're unwilling. You know, you've just empowered all the women watching with knowledge to be proactive about their own health. Advocate for yourself, ladies. If you're not getting the help you need, like this is your life. Start taking charge,
Right.
right? Dr. Gersh, I know you're giving an incredible gift today for the women talking. Do you want to speak a little bit about the Menopause SOS, your mini menopause survival guide?
Absolutely. It's primarily a lifestyle guide, and I'm so glad that you can all get it. I hope you'll read it. I think it's easy, really excellent reading, and it will really sort of, put the nail in and take care of it. It'll, hone in on all the things that you really must focus on from a lifestyle point of view to help you to navigate through the menopausal transition and all the years thereafter to optimize your health, because this is it. This is your life, and you don't get a second replay. So this is it. You can replay me, but you can't replay your life. So and it's so interesting. My father always said his whole life, and of course, as I got older, I totally agreed. He said, if you don't have your health, you have nothing. You can have $1 billion, but if you have heart failure, I can assure you, you'd give it all up to have a heart that's working. If you have dementia, what is that worth it to you? To get rid of dementia. Without health, you cannot be dancing, and traveling and having fantastic relationships and having fun when you're 98 or thereafter. You want to not just be alive. You don't want to have just breath coming in you. You want to have vitality, and you got to get going on it, and you've got to take ownership. Like you said, do whatever you need to do to get a team put together to work with you and take charge of what you can control yourself. You can control what time you go to bed. You can control what you put in your mouth. You can control the people you surround yourself with to a reasonable degree. And when you can't, like family members who drive you crazy, I say put up a force field around yourself so that they can't really quite get to you, okay? So you've got to protect yourself, and you can't fall into the trap of the medical world that trivializes you and your symptoms and menopause. No longer take that. Do not. Don't take it.
Yes. I'm so glad you said that. Everything was spot on. And ladies, if you're watching this and you're maybe in your 40s, 50s, this might be the first time you've actually put yourself first. I know that we have very busy lives. If you have children, they kind of take over your life. So what Dr. Gersh is said is so important. Now is the time. Go grab her free gift. Start there. Just start there. And if you need help, find a practitioner that can help you, that can hold your hand. This is so important. So go grab the free gift. It's in the email that brought you to this recording. Rewatch the recording a couple times too. Take some notes, have a conversation with the doctor, do whatever it takes to take the next step and then the next step and then the next step and just keep going. This is your life. Thank you so much, Dr. Gersh. This was amazing. We really appreciate it.
Well, thank you for this invitation to hopefully energize everyone to take the right steps for their own benefit.
Thank you.